Headache, when one of the most common cases that came in the exam came with different scenario. But from the beginning, when you are stay up out the door of exam, there is not, or there is complaint that they mention it on the paper, contain name of the SB and some or main complaint, if there is any finding or signs that sometimes they put it from the beginning. If the headache came with fever, or if the patient says that I have fever, this is mainly go with infection like meningitis, like sinusitis, yeah, otitis media, or something, tonsillitis sometimes, or any upper respiratory tract. Because in one exam, I think in Sri Lanka in 2021, one patient came with fever, with headache, and from the beginning he starts saying that I have fever, I have headache, with nasal blockage. Directly after this, most candidate they think this may be cluster headache, but not cluster, because when you ask him that if you have any other symptom, he say I have fever. Sure, cluster headache not come with fever. When he says that, even if he says that my eyes congested, I have nasal congestion, I have heaviness, like that, just not go with when he mentions that he has fever, this is not go with cluster headache. Due to that, I advise candidates that if from the beginning concentrate with associated headache symptoms with headache. If this headache come with fever, this is guide you to another direction, and if this headache not contain or not associated fever, this is another pathway. Just I want to raise your attention regarding this point, because many candidates that they will be confused with headache and headache scenario in the exam. And also very important to ask about the red flag with headache. Red flag with headache is depend on the type of headache. That if this headache is cluster headache, migraine, or go in this pathway, or this headache with infection. If this headache with infection, sure, you will ask about the change in vision, any dizziness, any numbness, or heaviness at any part in the body. With cluster headache and migraine, sure, you will ask about anything related to cranial nerve weakness, or any feature of CVA, or brain tumor, or something like that. Just to save the time, you can say that if you think this patient came with just headache, severe headache, and even if it's you think this may be cluster, it's very important, or migraine, very important to ask him about any weakness in at any part in your body, any change in your walk, or any change in your vision, just, or any numbness at anywhere in your body. This is make you that at the safe side, and you that mean you are asked about the cranial nerve palsy, most of them, and any CVA feature of CVA. Good luck, and I hope to see you in next video soon.